challenge. Interestingly enough, and we need to go back to the current slide, one of the most challenged books reported by the American Library Association is based on the true story of two male penguins who found an egg and hatched it and adopted it and raised the chick. It's based on a true story of these penguins from Central Park in New York, the zoo there. And the book is called And Tango Makes Three. Well, this is much too threatening for a lot of people, and so they have tried to prevent it from becoming part of the school library in their own public school system. So it's far and away the #1 challenge book, because some truth is not worth knowing. Let's take a look at some of the health risks. Lesbian, gay, bisexual, transgender community are, like many other minority groups, they suffer from their minority status. And so it's not surprisingly that we find among those groups the highest rates of substance abuse, alcohol, smoking, and illicit drugs. It's probably not a well-known phenomenon, but one of the highest rates of smoking is among rural lesbians. Just a little tidbit in case you didn't ask questions like this. Part of it is that in the earliest times, especially in times when pre-1973, where sexual orientation was considered a mental illness, gays and lesbians often congregated around bars. And so it's not surprising that there's been heavy rates of smoking and drinking in such settings. There are also higher rates of depression, and with it, higher rates of suicide, and higher rates of sexually transmitted infections among males. And there have been heroic efforts in the gay community to try to encourage safe sex. And also somewhat disappointing is the fact that there's much lower use of healthcare services. Many gays, lesbians, bisexual, transgender people are very afraid that they will be discriminated against and treated poorly when they go to seek healthcare, and some of that is based on the reality of having those kinds of experiences. Now, the issues for youth are quite startling. LGBTQ youth are the only minority group who have to worry about telling their family about their minority status. I mean, black kids don't have to tell their parents they're black, and Native kids don't have to tell their parents that they're Native. But LGBTQ kids worry a great deal about telling their families, because for many of them, it's the end of their relationship with their family. That's it. And they get thrown out. In some cases, they end up on the street. Fortunately, Wingspan has programs to try to help kids like that. So for youth, it's quite startling. Now, there's a national survey that's conducted on school climate. I'm going to share with you some of the results of not just LGBTQ people, but also a full range of the sample. And here are the results from the Arizona survey. 98% of the kids had heard the word gay used, and invariably it's always used negatively. About 82% were verbally harassed, 43% physically harassed, and up to 22% had been physically harassed. You may have read the story of two 11-year-old boys who had been harassed at school and both ended up killing themselves. Well, 64% of kids say that they never reported harassment or assault. And why would they not do so? Because of the following. Only 40% said that it resulted in effective intervention by school staff. So this is a very serious problem. It's one that many schools do not want to deal with, or do not have policies to deal with. So I guess the question for you is, do you know whether your school system has an anti-bullying program? And if so, is it effective? If you don't know, you should. I called up Canyon Del Oro, which is my school district, and they have a very detailed written policy and procedure in place. I don't know how effective it is, but it's clearly very well thought out and hopefully well implemented. There are a number of health issues for LGBT elders. In terms of access, we see that, again, they tend to use services much less than their straight counterparts. In terms of sexually transmitted diseases, although elders may be at risk, one shouldn't assume that all gay men are at high risk. There are many monogamous long-term sexual relationships, in which case there is no risk of a sexually transmitted disease. Lesbians need pap smears even though they're not having sexual intercourse. In fact, if they haven't born children, they're at greater risk for cervical cancer, so they definitely need to get pap smears. There are some neglected areas of care. For male to female transsexuals, they still need prostate exams, and similarly, female to male transsexuals still need pap smears. Hormone therapy is usually needed throughout life for people who are transgender, and in many cases their healthcare policies will not cover that therapy. In issues of health, I think I've mentioned about shame, suicide, substance abuse. Domestic violence is often an area that occurs in straight relationships or gay relationships, although the police tend not to take gay relationships quite as seriously as straight relationships. Part of it is because they always think that the victim should be a woman. Transgender community, if they want to have sexual reassignment surgery so that their psychological being matches their physical being, it's incredibly expensive, and it is usually not covered by most insurance policies. So this is just part of the incredible inequalities that exist for the LGBT community, and especially for elders too. What are some of the things that could be done to help reduce some of these social inequalities? For example, they could include the word partner in intake forms asking about marital status. If you go to a doctor's office or you go to some social service agency, they usually ask you your marital status. Are you single, married, widowed, divorced? That's it. The whole world has to fit into those 4 categories. Well, that basically tells same-sex couples, you don't belong. That's basically what that organization inadvertently is saying, because they're always making heterosexist assumptions about how the world should be rather than how the world is. So this is one of the things when I'm working with healthcare agencies, I try to encourage them to change their forms to be more inclusive than they are right now. We should allow unrelated same-sex couples to live together in nursing homes and assisted living facilities. Many such facilities will not allow such cohabitation, and that's what they consider it, cohabitation. You can have a couple that's been together for 40 years, they have to end up going into assisted living facility, and they have to be separated. Those are the laws that exist. We should encourage social service and healthcare agencies to have LGBTQ cultural sensitivity training for their administrators and staff. Wingspan offers some wonderful programs, sort of a 101, which is kind of a basic program, and also especially one that Penelope and I and others have been involved in, which is called Rainbow Training, where we would do a 2-hour workshop for healthcare and social service agencies around LGBTQ cultural sensitivity, and it's pretty powerful stuff. So if you have an agency that you think might be interested, contact me, contact Penelope, and we'll set them up with a program. It's no cost to them. We should also require local, state, and federal surveys to include questions about sexual orientation and gender identity in their demographic descriptors. This is happening more and more, but there's still lots of surveys and agencies that do not do so. I've had running battles with the state health department to include these descriptors, because one of the problems we have in knowing the extent of the issues that exist is if you don't include that information, you don't know what the nature of the health problems are. I mean, unfortunately, and the transgender community is always in the bottom place in terms of they get the least amount of attention. We know so little about the health issues pertaining to them because they're never asked on descriptor forms about gender identity, which makes it extremely unlikely that we're going to be able to develop effective programs and interventions. And probably one that shouldn't bear repeating for the CFI folks, there's so many of us that are secular humanists, is that we should value every human being and fight discrimination wherever we find it. Thank you.